Welcome everybody to this first side panel on purposeful partnerships. Thank you for joining us. We hope you've had a good first session attending the various parts of the hike conference so far. This is one of the really interesting discussions that we're going to have today, which is on this question of purposeful partnerships. And the whole idea of purposeful is intentional partnerships that take advantage of the capabilities that different people bring to the table to try and create a greater whole. We have a really interesting panel with us joining us today from across the health sector and beyond, and look forward to what should be a fun conversation. Recognizing today's International Women's Day, I will first introduce the ladies, and hopefully people will come on video as the introductions are made, and then we can get started. First is Alan Asimwe, who's the Chief Technical Officer at Trademark East Africa. Karibu, Alan. Dr. Hawa Mohammed, who's a Technical Officer at the Center for Maternal Newborn Health at the Liverpool School of Tropical Medicine. Welcome, Dr. Hawa. Justin Apse, who's the Vice President for Africa Transformation at Unilever, Kojo Boache, who's the Director for Public Policy at Facebook, as well as Eong Ebai, who's the Zone Manager for Sub-Saharan Africa at GE Health. That's the panel that we have with us today. And to guide you through this conversation, my name is Edwin Macharia. I serve as a Global Managing Partner for Dalberg Advisors. With 30 offices now across the world, we are the world's largest impact-first advisory firm. So very much deal with exactly these kinds of questions of how do you create purposeful, intentional partnerships that bring the capabilities of different stakeholders across public sector, social sector, private sector, to really tackle some of the biggest challenges that humanity is facing. Our mandate, our mission as Dalberg is building a world in which all people have equal opportunity to reach, to reach their fullest potential. And the questions of partnerships is so important and so critical to be able to get there. So super excited about today's conversation. We will largely have the conversation in two parts. The first part will be, in some ways, the easy one, which is let's talk about successful partnerships that we have all seen, been part of, helped create, develop. And so I'll ask each of our panelist members to reflect on the partnerships they have been part of, particularly in the COVID world. And then the second half, we hope to talk about partnerships that haven't gone well. I think it's too often too easy for us to talk about the successes, yet there are such critical lessons to learn when things go badly. And so I've asked all of them to think ahead of, in as much as they can admit failure, to think ahead of things that have gone badly and what are the lessons we can learn from them. To those who are members who are attending, there are two opportunities to engage with us. One, of course, is through the chat. If you have questions you'd like to ask or follow up on something somebody has said, please use the chat function or the Q&A function, where you can find the button at the bottom of your screen. We also have translation. For those who are French speakers, you can choose the language that you want to listen to in English and French. I think most of the speakers will speak in English, but there should be French translation for those who need it. All right, without further ado, let's get into it. I will start with you, Dr. Hawa, in some ways, because we want to start at the core of where these discussions begin, which is the health sector. And in your work, where you've been thinking deeply about bringing knowledge to nurses and midwives, particularly in the COVID world, you've had to adapt to how you've run your programs. And I wanted to at least open with you to give us some of your reflections of what you have learned about creating some of those partnerships in a purposeful way in this pandemic period. And for those who are in the audience, unfortunately, Dr. Hawa's internet is not great, so she might be off video for most of the call, but hopefully the audio works well enough for us to hear you. Dr. Hawa, over to you. You're on mute if you're speaking.
Oh, there you go. Thank you. Thank you, Edwin. Good afternoon, everyone. Thank you very much. And I'm really happy to be on this panel today to discuss purposeful partnership. So we are at Liverpool School of Tropical Medicine, work in the International Public Health Department, and our work involves mostly emergency obstetric care and quality of care. So we provide capacity building for skilled health workers to improve on the quality of care they give mothers and newborns, and then to reduce the risk of adverse birth outcomes. Having said that, it means most of our work involves face-to-face competency-based training of health workers. But with COVID-19, you know, the challenges that COVID-19 brought, we cannot continue doing what we have been doing. So we utilize the resources that we already have in country. We have a large pool of master trainers that were trained in all the courses that we run. And we also have hands-on obstetric and newborn training equipment. So with that, early on when the COVID-19 pandemic started, we started developing virtual training programs. So in the first 3 months, we developed the emergency obstetric care refresher training and mentorship training. So we're able to provide that virtual training to health workers. We trained master trainers that we already have in country to be able to provide this course training with support from Liverpool, from some of the UK-based master trainers. And at the same time, we also provided opportunity for peer-to-peer learning via WhatsApp groups. And initially, we started using Zoom and YouTube to host our training packages. But as you know, that is not very sustainable. So we were lucky to go into partnership with the World Continuing Education Alliance, which is a site that provides technical and the technical platform where we can come and host our trainings. They don't provide any training on their own, they just have a platform. So we've been able to partner with them. We got funding from Johnson & Johnson and FCDO in Kenya and UNFPA. So we're able to host some of our training with them. Thank you.
Yeah. Thanks, Dr. Hawa. And actually, I think that's a fantastic segue to over to you, Kojo. In some ways, it's good to hear WhatsApp is being used, right? But when you think about platforms, you know, and Facebook is one substantial platform of this nature that has been, what kind of partnerships have you seen come together in this period that are of note in transforming the way people and countries have responded to COVID? And then we can broaden beyond and say, okay, what does that mean for social media platforms more generally?
Okay, you might have to remind me about the second part of the question once we get going. But first of all, to female colleagues on the panel and also in the audience, happy International Women's Day. Kudos to all of you for the brilliant work that you do. How we've helped people respond differently, I can first probably pick on the fact that we've made significant changes to our platforms, most notably WhatsApp. So I know I'm speaking to health professionals, but everyone in general would have seen some of the changes we made to WhatsApp. So expanding the number of people on video call, for example, was done, people may forget, but it was done in the midst of the pandemic to enable people to connect. So I think I can wax lyrical about the ways we've done that and help create better connections between people. But I think it's the connections that we've had or the work that we've done with governments, with most notably with health authorities and with blood donation banks as well, which has probably been where we've been strongest. And I could choose any of 40 partnerships across the continent with actual health authorities. The Nigeria CDC is probably a real standout one in terms of the way we built the partnership. Really committed to excellence in both building it and in execution. And they will tell you that social media played a really, really important part in helping to inform people, most of all, guiding them to authoritative information. And we did that in a number of ways. I think important for us was understanding the risks or threat posed by misinformation with regard to the pandemic. And we were, as we always are with misinformation and speech that can cause real world harm or indeed less bad risks or less bad outcomes, we ensured that we were focused on removing the worst kind of misinformation with regard to the pandemic, the stuff that really puts lives at risk, i.e., this doesn't exist, or this is all fabricated, or this is down to your 5G mast, or whatever else it might be. Reduce the less dangerous forms of misinformation. So there are things that are put out there that can be a part of free speech, one might say. And in those instances where we know it could lead some people the wrong way with regard to how they might protect themselves. We focused on reducing that. And if you looked at your Facebook feed, you may have seen some information, but much of that would have been reduced, sometimes as much as 80%. And in other cases, some people would have noticed on their Facebook feed that we've actually focused on informing people. So giving people access to authoritative information that helps them debunk the mistruths that are there. And I think that's been a big area of focus for us. I can touch on one more partnership. As I said, there's many around the continent, but I can probably touch on one we've done with the Africa CDC as well. And again, really intentional about how tech, social media, and indeed our platforms as form of workplace can be used to streamline information sharing, not only to the public, which is really important, but between organizations. And you know that at a time of pandemic with disease that's unfamiliar to all of us globally, and being unsure where it was going, you can also have, there's a need to streamline information internally to make sure the left hand and the right hand know what they're doing. And we built a number of partnerships around that as well. I don't want to take all the time, and maybe I can come to others, but there have been others with regard to data for good, where we've ensured that some of our data for good that we've been able to accumulate. This is anonymized data, whether it be population maps or whatever else, has been accessible to data scientists across the continent, who then use that to inform governments. And some governments have, put out messaging about when to stay home and when not to. And those data scientists, in this example, have been able to help those governments understand how effective their messaging has been. So I could really wax on, Edwin, about the successful ones across the continent.
Perfect. We will come for an example of the failures. So put a pin on that one and see what hasn't worked well. But one quick question for you is, why is this important for Facebook? Or why was this important for Facebook as an institution to do something about it?
I think our reach means that we are going to be, our reach globally, 3.3 billion people using our applications every month, means that we are acutely aware of the role we could play. And if you think about the nature of pandemics and public health policy, and I'm so glad that I'm with experts on this, but I think I've learned a bit over the last year or so. So much of that is about getting health policy right, but it's also a big part of that is communicating that health policy. And I think we just play an important role in doing that. Our mission, as people know, is to give people the power to build community and to bring the world closer together. We firmly believe through Facebook, through Instagram, through WhatsApp, that we were able, we could play a role in doing that. So if you look at things like our COVID information centers, which were accessed more than 2 billion times across the continent, and you may have seen that at the top of your Facebook or your Instagram feed. You click on it and it goes in, how many infections have we had, how many deaths have we had, how do I put on a mask, what's PPE, that kind of thing. Those things, for example, those were available in every single African country. And I say African meaning sub-Saharan and North African country. And those things have been incredibly useful to people. So I think it was evidence of what we knew. Evidence certainly of what we knew, and certainly what we felt our responsibilities were to help, and then to ensure that our platforms weren't misused at a time of real importance globally.
Global need. Fantastic. Let me come to you, Ayong, in some ways as a more traditional player in the health sector, right? So GE Healthcare is a critical part of delivering products and equipment to the health sector. What have you seen that has worked well in terms of partnerships that you've been part of building to date? And are there any examples or nuances that have come forward given the COVID pandemic situation?
Yeah, so thanks, Edwin, and happy International Women's Day to everybody, and privileged to be part of this panel. Look, I think GE in Africa is essentially built on partnerships, right? And we can look at everything from financial partnerships through to construction companies to operators, etc. So I think we form partnerships across pretty much everything that we do, and stretching across the whole kind of wing-to-wing process of healthcare infrastructure development. But I'll kind of focus on a couple of, first a tech one, and then maybe a finance one, right, if that kind of fits the bill. So if you look at what happened during the pandemic, and it's also linked in with the COVID pandemic, the use of X-ray technology was one of the leading ways in actually diagnosing and monitoring the progress of patients that caught COVID and had major respiratory illnesses. And look, coincidentally, we had spent a lot of time focusing on startups, seeing how we can integrate AI into our equipment as a standard way to support clinicians to make diagnosis or make clinical decisions by using our systems in a way that also kind of helps alleviate the strain on clinicians. When you're looking at the numbers of clinicians that we have in the continent, so I'm not going to go through the stats, but we all know, there's not enough radiographers, there's not enough physicians, there's not enough interventional cardiologists, etc. So GE, a couple of years ago, partnered with a small startup called Lunit, who are, an AI, med tech company, building algorithms to kind of work within diagnosis to see how they can, use certain markers from X-ray technology in trying to figure out, diagnosis, prognosis, etc. So we worked, with a partnership, as I mentioned, Lunit, and within our X-ray systems as a standard in the continent, we've got a product called Thoracic Care. And what Thoracic Care does, it takes 8 algorithms, 8 AI algorithms. And when you have an X-ray, it's able to run the algorithms to support decision making over whether you have some form of respiratory illness, automatically without any input from any human being, right? So so you can see huge volumes of X-rays going through a facility, and you can have a much lower number of radiographers or radiologists in situ, while the system will give you, a pretty accurate prognosis, diagnosis of the illness that patient may have. And you can use this in TB as well as in patients with COVID that, are moving towards suffering from pneumonia. So I think that's an interesting, adaptation of a partnership with a small biotech company, based in San Francisco, that ended up having a huge impact on the continent from a COVID point of view. And then you kind of going from the complete opposite end of the scale is around some of the partnerships that we've had in financing and giving capabilities and ability to small and medium-sized healthcare providers to access, single-digit loans so that they're able to invest in an ultrasound in a small town, where they're able to treat patients that couldn't afford to travel to the major city to access care. So I think, and we've got, numerous number of programs in that space, working with local banks as well as with other international funding organizations to be able to provide some, like I said, low-cost loans so that people can, loans and maintenance and grants to see how people can actually afford equipment to actually plug some of the big gaps of the public sector in a lot of the countries that we look after. So I've got many more, but I think I'll stop with those 2 there.
No, sounds good, and we'll come back to that. And I'd actually say, if you can, in the chat, if you could put the name of the company you worked with, so that people would be able to look it up and just learn more. I think that'd be quite powerful. Justin, let me come to you. As Unilever, consumer-facing, company. As I know, in part because I'm in Kenya, and I know you guys jumped very quickly into the National Business Compact, really trying to bring business capabilities to respond to COVID, specifically in Kenya, but some of those principles got, spread beyond. Could you talk a bit about what that structure was and why it was important for Unilever to get engaged? And are there the kinds of principles that people can start taking from this to say, if I want to build a partnership, it should have the following types of things in it if it's going to be successful?
Thank you, Edwin. Yeah, so listen, let me talk a little bit about the National Business Compact against COVID and how we worked in there. I think I'll allow people to take their lessons out of it, if that's okay. And I can always come back and spend a bit more time on, I think when we get to the failure discussion, a lot of the things which worked with NBCC because I had failed and we had failed in some of the areas. So for those of you who are not aware of that, what it was in Kenya. It was a business compact pulled together, which allowed for public, private, and development partners all to come together to deal with the pandemic in a number of different areas, whether that was infrastructure or communication, behavior change, funding in that space. And as everyone said, as Unilever, we jumped onto it fairly quickly. For us, it was a very important coalition for us at the start of the agenda, and we used it really at the start of the battle when things were a little bit crazy. We weren't sure what was going on, and that's always a good time to do it. We knew we wanted to contribute, but we also knew that if we went alone, it wasn't going to work. And that's probably one of the biggest learnings we'd had on a number of different things we'd stepped into before. And we had built up a lot of friends and people who we'd worked with in the public and in the development space through other initiatives that we had done. And so working in the model for us wasn't actually that difficult. Very often corporates struggle to operate in those models because they haven't worked in them before. And they're always trying to get results and force results. And sometimes you just have to let it evolve with you. And for us, that was okay. But the real power was the fact that we got all the soap manufacturers in at the same time, really, really, really quickly. I'm not going to name all of them, but you would know the competitors that we have on different spaces in that area. And we were able to align very, very quickly on the messaging and the contributions that we wanted to bring to Kenya, which is very important to deal with when you're going to be going out on a mass level to educate the people of the country. And through the Marketing Society of Kenya, which was part of the NBCC, they quickly developed the Commercial Corona campaign, which was a very clear campaign that rallied all manufacturers to contribute however they could, whether that was airtime, where we actually donated airtime as part of manufacturers for communication to go out nationally, billboards, product wash stations, really allowing us to bring it to the people in one seamless way, rather than each of us trying to do it individually. It also avoided a massive amount of duplicated messaging. And this is the most important thing, because us as manufacturers, we understand that our power is in behavior change and communicating to people. And by coming out with one single message, and in fact, many of us went out with the message of use soap, not our soap, any soap. But when you do it, wash your hands this way. And this is how you do it. And I think, if you go back to the question you asked me at the start of why did we get into it? We believed that we wanted to make a change in the hand washing protocol and procedure in Kenya. And we were able to do that through the behavior change program in a way that was seamless and really allowed the other parts of the system, which is water, PPE, wash facilities, all of the other stuff, which very often you don't think about. Yeah, you get into it and you get into that stuff to really be deployed with scale and efficiently, because we had done the messaging really, really well through the NBCC as a soap manufacturing partnership.
Super, super useful. And I know of the NBCC quite well, and I saw it in action. And I think it's commendable pulling together people who are naturally competitors and saying, this is bigger than all of us, right? And we need to find ways to help shift the curve, right, for everybody collectively. So thanks for that, Justin. Let me come to you, Alan. In some ways, folks might look at trademark and wonder, why are you on this panel to talk about purposeful partnerships? But in some ways, if goods can't move, between countries, we suffer, right? And I think Africa, most African countries realized how isolated we could become if, given the volume, if goods were not moving and coming into the continent, how muted our own COVID response could be. Why don't you talk, I'd love to hear from you what you saw and what the experience was in that, in trade flows across the continent, but more importantly, how it is that we adapt going forward. And and I know Trademark is a partnership building institution at its heart, right? So what are some of those principles, perspectives that would be great to seed the conversation there?
Thank you so much, Edwin, and good evening to everyone. So it's so interesting that listening to the gentleman and the lady, they're all clearly health experts, or they have a good understanding of the health sector. With us, Trademark, we didn't know much about the health sector. We are trade experts, and we do our work well in terms of reducing the barriers to trade and the costs to trade within the Eastern and Horn region and Southern region. So when COVID hit, we were scrambling, like many other players were scrambling. How do we deal with this? And I think now more than ever, the intersection between trade and health became very out there. We couldn't pass goods without getting the Port Health Authority's approvals. And remember, Port Health was always one of those not very well facilitated. They were there to look at Ebola, they were there to look at vaccinations, but perhaps it wasn't the most facilitated team at the borders. So immediately COVID happened, countries locked the borders. We saw value chains and global value chains and supply chains immediately impacted. We couldn't get in supplies, we couldn't get in PPE, we couldn't get in medicaments, but we couldn't also get in factory inputs to support construction and manufacturing. So what happened is immediately we started seeing tailbacks at the borders. So all the goods that were already coming in were held up at the various borders. If you look at a country like Uganda or Rwanda, which are landlocked, all their goods were held up in Kenya. At one point at the border between Uganda and Kenya, we had a tailback of over 66 kilometers. Now you can imagine for those health experts what that means. These drivers are sitting in the cars, they are engaging with the communities. And that's why within no time, you found that long distance drivers, like had happened before with HIV/AIDS, became such a strong vector for transmitting. We had seen this happen with the airlines, where travelers were transmitting disease, but now we saw it with the drivers. So what happened is that now drivers became a focus of attack and the borders were even locked up more. So we swung into action because we didn't understand the health aspects. We knew our trade aspects, but we knew we could not get, at the moment, at that, if you look at the politics, the health ministers were ruling the day. They decided which border opened, what went on. And so we started engaging with the Ministry of Health to understand the needs, but we also engaged with partners like AMREF. If you look at the border communities, their livelihoods thrive on health, but the markets were closed. So we worked with AMREF to create what is called a safe trade protocol, where we could say, if you're working in a cross-border market, these are the protocols to apply when you have to use the market, because these communities, their livelihoods are all about trade at the borders. We are also working with AMREF and other partners to create the safe trade zones. So like you have APZs, we are now looking at safe trade zones where border communities can actually trade across in cattle, in grain, and all this work is only possible because we have partnerships like AMREF who understand what the health needs are, what the health priorities are, what we need to do. But we have also broadened our partnerships to others like the IOM on testing. We've worked with them to test truck drivers at the borders, in developing tracking applications for truck drivers. The first tracking application, I think in Africa, if not globally, was one that we have pioneered to track truck drivers and have a COVID certificate that is online. So there's a lot of work that we have done with partnerships with the WFP on making sure that humanitarian goods are moved and fast-tracked across the borders. And we have also worked with others like UNOPS and the UN family. So partnerships have helped us find our feet. Partnerships have helped us implement amazing projects and really ensure that our region is not at a standstill. I think if you look at our region compared to Southern Africa, where they've had long blockages, you find that at least here, a lot is happening because of these strong partnerships we have created with the health sector. Thank you.
Fantastic, Alan. Super useful. And I was seeing Justin nod a lot because I think he was probably on the other side of trucks being stuck. Like, I can't get my product in or out. What's going on? What do I need to do? So Justin, let me come to you actually on that note, right? So both reflections of what Alan has said, but also beginning to pivot the conversation to the practical things that you have to do to make a partnership work, right? And in that, you can begin weaving in, if you have a good example of partnerships that didn't work, which could have been part of the lessons that you brought into NBCC and some of the other platforms.
Okay, yeah, definitely. Thank you very much. Yes, I definitely remember the long queues into Uganda and some of the challenges. So thank you very much to Alan and the AMREF team for the help that they did there. Yeah, I think I was thinking a little bit about failed partnerships. Obviously, there are many. In 20 years in Unilever, we've done a lot with a number of different people. I think the one which probably stuck with me the most, was probably got the most learnings, was work we did with Domestos, one of our brands, which is very much in sanitary and sanitizing and cleaning, where we looked to put toilets and started to build toilets, and we focused very much on schools because we understood the need for it to be done there, one from education perspective and the amount of people who lost school days because of not having good toilets, whether they are for sanitary levels or for going to the bathroom, or even some of the menstrual cycles for women and not having safe places to be able to deal with those in school environments. And becoming very difficult to manage. And given it is International Women's Day, it's probably the best example I can use at the moment. And we spent a lot of money building a lot of toilets in a lot of places, and really, quite frankly, didn't do very much. I remember some of the times I'd go back after a couple of weeks, and those toilets were either not used, or they were not being looked after, or the products which we had provided had run out, and therefore there were no more to be used. And what was really clear for me was that we were trying to do it ourselves. We were a sanitary provider, and we weren't thinking broadly enough in terms of how we could do it. And when we started to open up the system and started to think in more a networked environment, a networked way of working, it was amazing to see how many people we were able to bring on in infrastructure, in education, in janitorial solutions, in municipality, in NGOs, in impact investors, all of these things which we didn't have any idea on, other than the fact that we wanted to provide some toilets at the start. So I think the first thing for me is always the power of together versus go it alone. A lot of people say they won't join in coalitions, they want to do it themselves. Having done it many times, I'm telling you, it's not a good idea. Yeah, you generally are going to fail if you try and go it alone. And I think the world is a good example of that now. Second thing for me is speed over perfection. I think you were involved with me a little bit on Safe Hands in Kenya and something. I think it's a wonderful program. It's an unbelievably ambitious program to deliver an immense amount of sanitation at affordable prices to the bulk of the population in an unbelievably creative, systemic way. But it was too perfect, I think. And we spent a long time trying to get it right with lots of stakeholders, and we didn't move fast enough on the smallest things. So getting going is the other big one for me, is if you don't start, you're never going to get there. And then many of my partnerships sometimes that have failed is because we spend too much time thinking and solving, rather than getting in and reiterating and finding solutions and then pivoting and moving. So using an agile methodology in what we do. And that probably links to the third point, which is systemic thinking over opportunistic donations. I think as a manufacturer and as a big multi-corporate, we've moved our thinking dramatically now to, while donations are important and they really do play a massive contribution to society and what needs to be done, they are not the space where we can use the power of our organization. Where we can use our power is in our case, Unilever, the behavior change piece, and therefore playing that part of the system, but then allowing the other specialists to come in to drive the positive feedback loops into that and making it work. And then while you're in there, be prepared to not get everything that you want or you think you need. I think that's the other big one for me. Sometimes I stayed in partnerships, even though I'm not 100% sure on why I'm there, and something has emerged. And that emergence is now proven to be a key part of systemic thinking. When you put divergent people together and leave them for long enough, sometimes things emerge that then create things that are much bigger, that are stronger in the system than they are separately. So yeah, I think that's probably my summary of what I would say through my 20 odd years of meandering failures.
No, super useful. And I couldn't agree with you on the point of move quickly and learn by doing, right? And I think to me, part of what that speaks to is have the decision makers at the table, because sometimes a lot of the desire for analysis comes from, and I'll be the first to say, this is what I do for a living, right? And so people ask me to do analysis, and I'm happy to do lots of analysis. But part of the challenge is that analysis is being used to convince those who make the decisions to move in a certain direction. And sometimes that is what slows down the ship, right? And so how do you make sure that you're bringing the right people at the table who understand why this is important and can act on it, even with imperfect information, especially in a pandemic where we all have imperfect information, right? There's nobody who knows what will happen tomorrow, and we need to get going. So couldn't agree more. Let me come to you.
Edwin, there's a couple of points. I think the paralysis by analysis is something that we focus on trying to avoid. I think we had a saying at Facebook that in the early days, which was, move fast and break things. I think we're a lot more careful. I think we're a lot more careful about breaking things now. I think that's top of mind for us not to do, but certainly the need to move fast. And then when you mentioned having the right decision makers around the table, I'm just thinking about some of the partnerships we established. And actually, I think it's about having the decision maker around the table, and then invariably there's someone who executes. So there's the decision, and then there's the person who executes, who moves fast, who does all of those things, who also has to be brought in. to that decision and why we're doing it as well. So I think that, and in our case, that's been particularly important across the continent. So I just wanted to add that piece. But thanks, Justin. Thanks, everyone.
Absolutely, totally agreed. Ayon, as somebody who's been in the health sector much longer, traditional health sector, what are your thoughts on these points around partnership building?
Look, I mean, we spend, well, I personally spend probably way too much trying to build partnerships in the public sector, right, which end up not working, And I think, from that, from the kind of historical engagement, I think you've learned a few key messages when trying to do healthcare projects at scale in the public space. You need, it's a bit of an art, really. You need to have the right ingredients. So timing is absolutely fundamental and critical. You've got to work on financing. It's all well and good having an amazing project to build, thousands of primary healthcare centers that's going to save millions of people's lives, etc., etc. But if you haven't figured out how is that going to be funded, how are you going to support the government in raising the money to be able to make it happen, there's no point even getting down to that level of detail, right? So, and a lot of my themes will be, funding driven, right? But look, clearly, working with your Ministry of Finance, working with, agencies that are going to support the programs to make them come to life, I think is an absolute starting point. So start with the money before you get into the detail. And then the next piece, again, standard work and standardized programs are what we like to do. And we like to do that at scale. We like to do national programs because we see the economies of scale and the impact that you can have within a community when you do that. But don't lose sight of the fact that, and I think Justin touched on it, you've got to get started, right? We could spend 10 years talking about doing a national program at scale and nothing happens in that 10-year period, right? Don't feel shy to say, you know what, okay, I'd love to do it across the entire country, but maybe I'm going to do it just here, and start somewhere and kind of prove the concept. But don't, at the same time, the flip side is don't get caught in the pilot trap where you spend all your life piloting in a small area, but you never actually use it as a launch pad to actually build the scale argument where the major benefits are and the economies of scale are, and that will support long-term, training and education and development in whatever you're trying to do, right? So, so think big, start small, but then don't keep on piloting over and over again. Find a way to be able to kind of quickly prove your concept. And if the cash is there, and funny enough, one of the things that has really hit home in the last few months through the pandemic is that there's a lot of capital out there for healthcare infrastructure projects across Africa. It's just whether you're able to build the right project with the right kind of evidence that's bankable to be able to access the funds available to go out there. So use your pilots to help you build your argument that makes it a bankable program that you can then go back to, the governments, be it at a national level or at a state level, to be able to roll out, programs that, on a larger platform will end up benefiting, a lot of the populations that you're trying to serve. So I think that's one of the big components of a public space.
Yeah, agreed. And one of my pet peeves, one of the things that really drives me crazy is in the pilots is when people use that to claim and own a space and not give others, right? So somebody is doing a small little pilot in a village in Kenya, and then they say, we cover Kenya. No, you cover a village in Kenya, right? and then they use that to dominate and kind of suck up all the oxygen in the room. And they're only thinking at small scale versus thinking at systems level, right? And so, that resonates very, very strongly. Dr. Hawa, I've seen your message saying your audio is going in and out, and I really wanted to come to you because, sorry, I have crazy birds in the background. Hopefully you can hear me okay. On the people side of these things, right, is we can talk finance and structure and partnerships, but at the end of the day, it's people who are sitting around a table and having a discussion. And given you spend a lot of your time training people, right, working with trainers to train people, what are some of the nuances in terms of the people management of this that would be important to keep in mind. And I hope the audio will be able to come back and you can contribute. But if not, I will ask any of the panelists to also respond. So over to you, Dr. Howard.
Hello, I heard half of what you said. Can you repeat that again?
Sorry.
Yeah.
Me too, yeah.
Yeah, sorry about that. Yeah, so what I was saying is partnerships at the end of the day are anchored by people, right? Institutions are people. And so from a people perspective, given you spend most of your time on the people side of this agenda, training people, working with master trainers, trying to change behavior, are there lessons that you'd be able to abstract upwards and say, to build a good partnership, here's how to think about it, and here are the practical things you can learn about engaging with people?
Okay. I hope the audio remains. So, you know, when you work with people, it is really difficult sometimes to communicate what you want exactly. But one thing I've learned is that when you listen to people and you engage them early on with whatever you're going to do, people tend to listen to you, and at least even if they don't agree with everything that you are trying to do, they can give suggestions. So we have worked a lot with so many people, the health workers, the master trainers, and the government. So usually with the people that we train and the master trainers that we train to train people, we usually have a better relationship. But most of the challenges we get is when we come to work with the ministries of health or the government or other local partners. That is where occasionally we get some hiccups in our relationship. And that usually stems from interest from these local partners, especially the ministry. Sometimes, even in the training of people, you want to train health workers, particular set of health workers, because we train people that work in the maternity unit mostly, because all the things we do is to do with maternal and newborn health. But sometimes you see the people from the ministry sending a participant that works in ophthalmology or psychiatry to come and be a master trainer for an emergency obstetric and newborn care course. So, and sometimes if you send these people away, it can bring a problem, between you and the ministries. So we try as much as possible, early on to let them know that this is what we are planning to do, and these are the particular set of health workers that it is meant for. And we just try as much as possible to resolve any conflict that arises, amicably. And just like I said, communicate. Thank you.
Super useful, and your audio was great. So thank you for that contribution. And it reminds me of work that we did on safe surgery, actually with GE a while back. And one of the most important lessons we learned is creating a surgery team is the biggest pathway to getting positive outcome in surgery, more than almost everything else. Right. And so this question about engaging people and building that, connection and bringing people, that collection together is such an important part. And sometimes when we're trying to build partnerships, we think institutions, and we forget actually the Minister of Health is a person, right? The head of the organization is a person. How do we make sure we do that? Let me come to you, Alan, just because I've seen you nod and smile quite a bit. If there's something you want to add to that particular element about the people angle, which is just as important to manage.
Thank you so much. In law, we have a saying, know your tortfeasor, know who you're dealing with. And often we forget that these people also have emotions, they have passions, they have feelings, and we just think of our own mission and what we want to achieve. And that happened to us because we are so focused on creating smoother transactions for anyone who is trading, for goods to move through. We thought we had the right to actually ask governments, please move goods because we need goods through. But the ministers of health, because they know what a pandemic like this can do to our countries, because they are passionate about it, they also stood their ground. So at one time I had to hound the Minister of Health in Uganda and sat in her office for 3, 4, 5 hours. She gave me audience and I was trying to explain to her how the truck drivers app was going to work, because the government of Uganda had just passed a decision that was saying either you have to have 2 drivers, one takes over, one moves the truck from Kenya, the other moves it to Uganda, and it was going to be a nightmare. I think it was just going to lock up the entire trade system. So I really hounded her, I called her up, I followed her until I finally got to meet with her and told her, look, I hear where you're coming from. I think people want us to hear them. I hear where you're coming from, but also look at this side. And I think together we can have a solution that can help our region. And finally, when she came to the table with the other regional ministers, they were able to work out something that finally now we have this tracker app that we now have 65,000 truck drivers within Eastern Africa that are on an app and they are being tracked every minute on GPS. So we can know where they are so that once they have tested, they are able to move their goods freely across the region. So the personalities matter, but I just want to touch a small issue on the issue of failure, since I know we are almost running out. One of the things we need to do is introspect. Many of us come to these partnerships feeling we are the ones, we are the kings and queens of what we do. We do trade, we know our stuff. Facebook, Kojo knows his stuff. But when we're now trying to forge a partnership, it becomes a challenge of who gives way, who knows what best. And I think trying to reach that middle ground really requires a lot of thinking. You might even think you've hammered it out, but you need to constantly go back, check opportunities like the one you've given us today to really reflect and learn. For us on our part, we really had to sit back and introspect as well on what we did best. We quickly realized we're not an emergency agency. We don't do emergency work. We are very good at what we do, but we are not emergency. We are not the WFP that will bring together 100 trucks in one day and provide goods. We are not Unilever that can commandeer a whole, load of soap and medicines and Dettol soap and get to us overnight. But we do our stuff well. So once we learned that, and once we knew where our strengths were, we were able to enter into better partnerships and to communicate better. Because we've had some very heated arguments with some of our partners. I've told you we've worked with the UN now, we're working with IOM, we're working with WFP. Some of the discussions have been quite heated. Even AMREF, they've been heated, passionate, because we all love what we do. But once we sat down and both understood that we shared the passion and the goals to actually make a difference, then it has helped us to iron out those differences. So right now, I can't speak of a failed partnership because all the partnerships we've entered into in this period, we have tried to work them out. Yeah, there have been some challenges, but we have worked them out.
I can't agree more with what Alain said. I think for us, many people, for good or for bad, I think Facebook can probably do much more than we can do. And I think what's so important to us to ensure that we don't have failures down the line is actually understanding what we might be able to do and what we can definitely do and what partners that are there may be able to do. So there have been partnerships where people have brought us to the table with brilliant ideas. And we can stay and stay abreast of things, but actually trying to interject or to contribute may actually slow down the impact or reduce the impact of those partnerships, and being able to step away is important. I think failures wise, I think I'm with Alain. I think because we've been so careful about choosing the partnerships, purposeful partnerships that we've entered into, it's hard for me to point to failures, and I would love to, because it would make me, and people who know me know I'm happy to. I'm a bit critical like that. But I can point to things that we arguably could have done better. Not arguably, in my view, we could have done better. So at the core of this, and I think what we've all come to know, is how important ICT and access to ICT is for the pandemic, whether it's for health workers in the field or people who want to find out about COVID or governments who want to put information out there. I think Facebook has made considerable investments in connecting people around the continent. I can wax lyrical about the money we've done and the partnerships we've done to connect people. I feel we could have done more there. I feel we could have done more to advocate for stopping internet shutdowns, which is something that continues. Alain will know, she mentioned the minister in Uganda. We had a shutdown post-election. We have continued blocking of Facebook in those countries. I think we could have done more to advocate and to highlight to people the problems of shutting down the internet, especially now that it's become so important for health. And we've spoken beautifully about the movement of goods and services, but the movement of data and enabling people to connect is probably just as important today in a health pandemic than anything else. And then I think the other thing we could have done, we had to do this slightly on the fly, was our Data for Good program. I think we could have done more to have partnerships in place already. I think we did an excellent job once the pandemic started of establishing partnerships with universities and data scientists across the continent. But I think it's been hypercritical. It had only been going since 2017, but possibly we could have done more to establish African partnerships. But I'm thankful we've made great strides since then. And I think now we know how important that data for good is. We will do much more in the future. But those are probably the things that I think we could have done better on, and we could have leaned into more if I was being hypercritical.
Oh, fantastic. That's the only way we all get better, right? Is that introspection and saying the things we know we can do better.
100%.
How do we do them? So we're coming almost to the end of the session. And so I'll ask the panelists to reflect on this one question, which then we'll do a round robin of answering, which is, what's one example of a crazy, super crazy, stupid, out of the box, partnership that needs to exist, but does not exist today, right? In part, I'm conscious there are lots of people who are attending who might have kernels of those ideas, beyond just the 5-6 of us. So what's a crazy partnership that needs to exist, but does not? So think about that. But to give you some time to think ahead, Enyong, there was a question on the Q&A group on government and how do you get governments to scale? How do you get beyond red tape and get governments to scale in the partnerships? Which I believe, given your work at GE and public sector is a major part of the partnerships you work with. If you could respond to that question, and then we will do the final round. So over to you, Enyong.
Yeah, sure. No, thanks for the question. Look, I think the biggest piece, I think we've touched on it, is around knowing your customer, knowing your client, and broad stakeholder engagement, right? And look, I'm gonna take you back to like a bit of an old story, right? But hopefully it will kind of, I'll make the point, So, I grew up in North London, and there's a small hospital called St. Anne's Hospital on St. Anne's Road in Tottenham. Right. And my first job in industry was a sales representative. So I used to have to kind of rush in with a whole bunch of sandwiches from Sainsbury's, set my sandwiches up to go present to the nurses and the doctors, at the education center at the hospital. Right. And there's this guy that, who sits on the barrier that allows cars in and out. He became my best friend. Right, because he allowed me to drive my car right up to the front door so I could grab my sandwiches, get in, in as quick as time as possible, get set up, right? So what's the relevance of that to what I do at the moment in Africa? You just don't know who a key person is to be able to unlock something for you and make your life easier when you're working on a transaction, you're working on deals, right? So, look, I've seen people get completely blindsided by going to the top and trying to speak to the minister, speak to the president, and do all this kind of stuff. But actually, there could be this guy who sits at the front door of the Ministry of Health. That's the person that gives you the tickets, that allows you to jump the queue to get to see the minister, that allows you to kind of get, have the conversation and engage with the people that you need to engage to. So I just think that, it's important to know all the stakeholders, leave your ego at the front door, and get to know everybody humanly possible in an organization. And I think if you do that, you're able to uncover so much things that happen while your file's not moving. Why are you not able to access the person that you want to access? Because governments are super complex, and they're even more complex in the continent of Africa. And a small issue in one little location and one little office can stop you from being able to move forward on, a transaction that could help, benefit the page, lots of people across a government. So I think for me, hopefully that makes sense. But, from a stakeholder engagement, everybody's your customer, everybody's your client, everybody's your partner, and, leave the ego at the door and engage with as many people as you can. And that will really help you formulate the right partnerships to be successful.
No, couldn't agree more with that perspective. I have countless stories of people who did exactly that, right? They assume I'll go and sit, they spend all their time trying to meet with the president. And the president says, yeah, that's cool. Now go work with my people, and nothing moves. And they always blame it on, well, nothing moves on the continent, yet you wouldn't do the same in any of the other markets, right? You wouldn't go to the US and say, I must meet Joe Biden first before I bring my technology to this country. So why is it that we assume that only Africa is a place where that has to happen, right? So anyway, let's put that aside. Let's come to the round robin of the crazy partnerships that you think should exist in the world but do not today. Hawa, I'll come to you first. Hopefully your audio is good enough and you have a good example. 1 minute quick fire.
Yes, I really have a crazy partnership. I just wish we could have, a partnership of all African countries, a really engaging partnership such that we can provide support instantly wherever support is needed, in education, in health, infrastructure, everything, just to have an African nation with, interconnections between all the countries. So I would really love to see that kind of partnership.
That's a fantastic one. Kojo?
Yeah, I'm the same. I'm not sure I can think of you might need to give me more time, Edwin. I'm not sure I can think of a crazy partnership. And I'm not going to think of one in the next 2 seconds either. I just think I think as Facebook, I mean, partnership is at the heart of what we do. And I think we're mindful, as hopefully I've demonstrated today, that we can't do anything alone. I think we're always keen to hear about crazy partnerships and the idea. If the impact and ability to scale, and I've heard what people have said about small scale projects starting with, but the ability to scale and have real impact on the continent is there, then we're always happy to hear about them. But I have to admit, I'm going to fail you on this one. Edwin, a crazy one at the moment.
No problem. Justin? Yeah.
Sorry, IT challenges. Can you hear me?
Yep.
Yeah, cool. Yeah, I'm a bit with Kojo. I don't really have the idea. I think there's probably 3 big wicked problems I've been thinking about quite a lot from an African perspective. I think the one for me is youth. Yeah, one of the big things I think we need to think about is how we're going to empower the youth of Africa. The demographic dividend or the demographic disaster, whichever way you want to call it, the way it's going to go and how we're going to use them. And how do you use that in the food system? I think the food system is going to be a significant challenge, and where particularly Africa has a chance to play a significant role, just because we have the most mouths to feed, potentially by the time we get to 2030, but also the land to make it work and the people to make it work, naturally built into us. And if 12 food sources currently feed the world, then there's a lot of work to be done with Future 50 and the WEF program. And then the nationality, which I think very much what the doctor was talking about, this idea of an Africa way of thinking. If there's one thing the youth do is they don't really give much about passports and visas and all of those things. So how do you find a way to bring youth and the energy which they have and the collective which they have, their ability to break across borders, which seems to be something we struggle with as we get older in Africa, in what we do, and how do you focus it on a food system, which I believe needs significant change to be climate resilient, more inclusive in the value system, and also changing the diet of a country which has been impacted by numerous things because of its diet. So there's something in there. I don't know what the answer is.
We will find it.
Bouncing around my head at the moment.
Yeah. Ayang?
Look, I think I struggle, but I think probably the biggest crazy partnership would actually be an African free trade zone where all countries across sub-Saharan Africa partnered, right? Reduced trade barriers and enabled us to be able to trade on scale like, they do in India, China, the US, etc. I think that would be a crazy partnership. And I hear that it's in reach, so let's see.
Yeah, fingers crossed. There are many of us who are putting our shoulders to that axe brand and see if we can get it over. Alan, you get the final word.
Thank you so much. I don't know whether mine is crazy, but it's certainly audacious. So I also oversee our climate change portfolio. And if we think COVID was bad or is bad, climate change is really going to hammer us. So I've really been, and together with our boss and the CEO and others, we've been thinking of a crazy idea of getting Elon Musk on driverless vehicles for Africa, because no one is talking about this. And I see Kojo smiling. So I'm already thinking of partnerships with Justin on Unilever, with Kojo on Facebook. So I'll reach out to you, and with you, Young, and of course, Dr. Hawa. My head is buzzing with so many possible partnerships out of this today. So watch out.
Look forward to hearing from you. And a Nigerian minister has spoken about Nigeria having driverless or electric cars to a certain percentage by 2030 or something like that. Very, very recently. It was hotly debated, so it's there. The discussion has started.
We need it to happen immediately because the emissions from the vehicles are high around the cities, the urban centers, but also along the corridors. So if we can get those connections going, please.
It's the emissions to the vehicles, it's the logging, it's the overmining of bauxite, of gold, of whatever else as well that we need to really be considering. For a long time, I don't want to buy into old development theory, but for a long time, these have been our areas of competitive advantage for us. So the more we think about sustainability, which is something Facebook is thinking about actually, but the more we think about sustainability and a post-COVID emergence that's founded on sustainability, the better for us.
Exactly. How do we build a better world, having gone through the shock of 2020? And we've actually been doing a lot of work around circular economy, food systems, and so on and so forth. So as you can tell, there's rich discussion to be had. But unfortunately, we've come to the end of our time, which is unfortunate. But I did want to say a major thank you to all of you panelists for